Okay, so welcome. This is Dr. Alma Nenshi, and I am so glad that you have taken the time out of your day today to be part of our Shoulder Pain Solutions webinar. It's a really important challenge we have with shoulder pain. A lot of people experience shoulder pain either from tension, from their neck, or from stress. Other people have specific shoulder problems that they're working on trying to resolve. So this webinar is going to cover 4 main challenges that people have with their shoulder. I'm going to take 2 little cases that I've seen in clinic that I will share with you as well, and then leave the floor open for questions and answers. We do have references for this webinar, so they're going to be included at the end of the webinar. And I can also email you the references like I did for our last seminar that we had last week on low back pain. I know a lot of you appreciated the links, so we can do the same this time. Okay, so here we go. I'm really excited about being here. Get down to our next slide here. So what we're going to do here is first talk about anatomy. So the anatomy of the shoulder is quite important. Most of the shoulder is very flexible. You've got 360 degrees of motion, mostly because it's the most mobile joint in the body. And the reason it's that is because it's a ball and socket joint. So basically you've got your humerus, which is your arm bone, and then you've got your shoulder, and then there's a little bit of a ball in a socket, and that's how that moves. The bones that make up the shoulder include the collarbone. It also includes the shoulder blade, and then the upper arm here, which is your humerus. And we have several joints in the shoulder. This one here is your glenohumeral joint. That's the ball and socket joint that we talked about. And then you have your sternoclavicular joint. So this is your sternum, and this is your clavicle, and that together makes your sternoclavicular joint. We also have an acromioclavicular joint. So you've got your clavicle, which is your collarbone, and it hooks up with part of the shoulder called the acromion. So that's located right here. And then you also have several ligaments that are in the shoulder. They're flexible bands of fibrous tissue, and together they just hold and connect all of the bones together. The tendons are the connections between the muscle to the bone. So it's that fibrous, tough cord of tissue that connects the muscle to the bone, and it helps to support the muscles and helps to move the arm and the shoulder in every direction. Okay. So, you know, the ball and socket joint of the shoulder has many movements that make it possible. So we talked about just moving your arm up and away. This is called abduction. And then when we add the shoulder or the arm back to our body, that's called adduction. Then we've got flexion, which is when you move your shoulder up this way. You've got extension as you move your shoulder back. And then you also have 2 other components. You can rotate your shoulder inward. That's called internal rotation. Or you can turn your hand out facing away from you, and that is called external rotation of the shoulder. So any minor injury can limit any of these ranges of motion, and that can be both frustrating and painful. And I can see from the people here on the webinar, I can see many of you who have had shoulder issues, and so you can relate with how frustrating and painful that can be. So there are common conditions in the shoulder that I'd like to be able to focus on right now. There are 4 main categories. The first is tendon inflammation, or what's called bursitis or tendinitis, or tendon tear, which is instability, which is a tendon tear. Then there's instability, there's arthritis, and then you can have fractures. So I'm going to talk about each of these individually. And here we go. So when we talk about tendinitis, you can have small fluid-filled sacs called bursae that act like cushions between the bones, and they overlap. Oh, sorry, I'm talking about bursitis first. they're small little sacs that sit in between the bones, and they overlap in order to reduce the friction of the gliding joints and muscles and bones that are happening in the shoulder. And so when you have these fluid-filled sacs, sometimes when you overuse your shoulder, or if you've had an injury that can cause swelling or inflammation of the bursa, that can cause this very sharp pain inside the shoulder, very deep inside. And often you can feel it when you're moving your shoulder. Sometimes people feel it when they're moving up. Many people feel it when it's coming down, and that's because these sacs of fluid translate in between the shoulder structures as the shoulder is being moved. So we certainly want to make sure that there's no inflammation in those areas. And there's also many types of bursa. You have your subdeltoid bursa, you have your subacromial bursa, and it's basically named by where that cushion sac is located in the shoulder, in the rotator cuff. Okay. So with bursitis, many activities such as combing your hair or getting dressed can become quite difficult. When we're talking about tendinitis, it's a little bit different. Tendons are the cords that connect the muscles to the bone, and inflammation in the tendon can cause one of two types of tendinitis. Acute tendinitis can occur when you have excessive hard, quick motion, such as you're throwing a ball or you're spiking a ball down when you're playing volleyball. That can cause irritation to the tendon, and it can be when you're working, if you're lifting. It can also be from doing any type of aggressive sport activity that calls you to move your arm in this throwing type of motion. Chronic tendinitis, on the other hand, happens when you have repetitive wear and tear, and you can have degenerative diseases like arthritis that can contribute to it. Usually what happens is you get an inflammatory process, and the inflammation causes the tendon to start getting fibrosed. And when the tendon starts to harden, it starts to weaken. And so you lose that elasticity in the tendon, and that can predispose it to further trauma and degeneration. The most commonly affected tendons are in the four tendons of our rotator cuff muscles, as well as the biceps tendon that runs down the front part of your arm. Okay, the rotator cuff provides the ability to move your shoulder, all of the four tendons, and keep the arm bone in its socket, right in place, as opposed to weakening of some of the rotator cuff muscles that can displace the resting position of the arm bone in the socket. Long-term overuse and wear and tear, especially if it's a sudden injury, can cause splitting and tearing of the tendons. And these tears may be partial tears, or in some cases, unfortunately, severe tears, where the tear can, or the tendon can be completely separated from the attachment on the bone. And your rotator cuff and bicep tendon injuries are among the most common of these injuries. If you want to talk about rotator cuff muscles, you can remember the acronym SITS, S-I-T-S. It's a supraspinatus muscle or tendon, the infraspinatus muscle or tendon, the teres minor tendon, and then the subscapularis tendon. And the subscapularis muscle is that muscle that holds your shoulder blade right up against the ribs in your back. So the subscapularis keeps that shoulder blade really close to your back. Okay. So let's talk a little bit about impingement. So shoulder impingement occurs when the top of the shoulder blade or your acromion puts pressure on the underlying soft tissues. And so when your arm is lifted away from the body, as the arm is lifted, the acromion rubs down or impinges on the rotator cuff tendons and the bursa. And then this impingement can cause bursitis and tendinitis as well. So not all of these conditions occur by themselves. They can be occurring simultaneously with other conditions. And that can, of course, cause pain and limiting in movement. So when you're trying to lift your arm up, that acromion is displaced downward and impinges or presses on those rotator cuff tendons. And that can cause a lot of pain and can limit your movement as you're moving your arm up. Let's talk about some instability. So shoulder instability or dislocations can happen when the arm itself is forced out of the socket. And this can happen as a result of overuse or injury. You know, we can think of a lot of like football players, for example, if they're hit from behind, their shoulder can displace anterior and can actually be dislocated. That's one of the most common dislocations in the shoulder. So partial shoulder dislocation is technically called a subluxation. Chiropractors have a different meaning for that word, subluxation, but the medical term means that there's a partial dislocation of the ball and socket joint, where the shoulder joint itself, that ball is just partially not resting properly within that socket. A complete dislocation means that it's basically completely out of the socket. Dislocations can occur repeatedly, so you can start getting loose and torn ligaments and tendons and muscles around the shoulder, and then recurring dislocations, which may be partial or complete. They definitely cause a lot of pain and unsteadiness when you're trying to raise your arm, and they also can cause increased risk of developing arthritis in the joint, which is definitely not a pleasant thing. So arthritis is when any joint in the body can be impacted. The most common type of arthritis in the shoulder is osteoarthritis. Again, it's the wear and tear, how you've been using your shoulder, and wear and tear can cause a lot of symptoms such as swelling and pain and stiffness. Often this osteoarthritis can start middle age, and it can develop very slowly. It can be related to sports and work injuries. It can also be from chronic wear and tear in the joint. And osteoarthritis will likely worsen over time. So that is a real big concern, because there's lots of things that we can do for osteoarthritis that can help support that structure. Other types of arthritis that can be related to rotator cuff tears, infection, and it could also be inflammation in the joint lining itself that can cause the arthritis. So you can have rotator cuff tears, infection, and inflammation of the joint lining that can cause other types of arthritis. And also arthritis, people will, with arthritis pain, people will avoid shoulder movements. So sometimes you will cause a tightening or stiffening of the soft tissues and the soft tissue parts of the joint. And when you stop moving your shoulder, there is a risk that that mobility can be further restricted, and you can get increased tightening the more that you don't use that joint. So while you try to protect it initially because of the pain, there is a risk that babying that joint inappropriately might lead to more stiffening and tightening of the joint. Fractures, shoulder fractures or broken bones, they often involve the clavicle, which is your collarbone. I remember in clinic when I was an intern more than 20 years ago, I had a patient come in, and I was an intern in Chicago at the Salvation Army Clinic downtown, and she had been mugged, and she had a sling, like a purse, over her arm, and the person had pulled on it twice, and that had basically dislocated and actually fractured that clavicle. So when we took an x-ray, there was a piece this way and then there was a piece up higher. And it wasn't that much force that you need in order to rupture or fracture that clavicle. It was an older lady, so maybe she had some osteopenia too, or reduced bone density in the shoulder blade. But yes, fractures can be very painful, and they can cause a lot of swelling and bruising around the shoulder. And our senior patients may experience fractures as a result of a fall from standing. An impact, a hard impact on the shoulder can cause a shoulder fracture. And even motor vehicle accidents can cause fractures in the shoulder, sports injuries as well. As we talked about, just as you can dislocate the shoulder, you can also fracture the shoulder. So like any injury, when you talk about shoulder health, prevention is really the key here. You can take several steps to ensure good shoulder health. And first of all, always listen to your body. I know it sounds really simple, but too often people ignore the pain that they're feeling in their shoulder. And when you ignore things, sometimes it can lead to further damage and prolonged healing. So if you experience shoulder soreness, or shoulder pain following an activity, please don't ignore it. There's no need to tough it out. It's not like no pain, no gain. It's good to take a break for a few days. Let your body try and heal the area. If the inflammation occurs, we know from previous workshops that we've had, previous webinars, that inflammation is healthy. It will bring all of the resources needed to try and heal that. So if you have a little inflammation, that's okay. Certainly, we don't want you to ignore the pain. If it's really severe and it doesn't go away, make sure you see your doctor, make sure you see your chiropractor so that you can get a proper evaluation and examination to determine what the problem is and then appropriate treatment. So another way to prevent injury is to stay active. Okay? You want to keep our body in good physical shape with regular exercise and a healthy diet. Physical activity is necessary. Okay? And I know we have physical distancing, but that doesn't mean we can't be physically active. And the thing about the shoulder is it's necessary to exercise it in the right way in order to prevent injury. So if you have a pre-existing condition such as a partial tear or bursitis, it's important to be able to do your workouts in a safe manner according to the instructions of your practitioner. So every workout needs to start with a proper warm-up before you actually begin. And you want to start slowly. If you haven't done a sport or an activity in a while, just start it slowly. First, learn how to lift. Maybe you want to just use the weight of your arm and not even start with weights. Maybe you add weights like 1 pound or 2 pound weights initially. Please don't lift too much right up front, because if you do have a pre-existing condition, you don't want to make that worse. And of course, if you spend a lot of time doing overhead motions, you have a job like electricians that come in to see me, they're always with their arms overhead. Plumbers are the same. And when you have your arms up over your head, that requires a lot of cross training. We need to not only work your rotator cuff muscles, but we need to work other areas of your back and your spine in order to make sure that you've got good stability in all of the areas that are involved. So also, cross training can be a great way to avoid injury when you are trying to maintain your physical fitness. So if you are a swimmer, you can do swimming, and then you can do biking in order to try and reduce stress on your shoulders. So use different types of exercise. That's what cross training means. Of course, we want to try and challenge and increase your strength. Now, again, please be careful how you do this, because we want to make sure that you are under the care of a proper doctor who has been able to help diagnose what your challenges are. And we want to make sure that we avoid making these particular pre-existing conditions worse. So assuming that you have a healthy shoulder and you don't have pre-existing conditions, there are some exercises you can try that you can use with either the weight of a water bottle or a 1 or 2 pound weight, and eventually you can increase that as you get better. So the first exercise I want to talk about is your arm circles. So if you stand with your feet, if you stand up and your feet are hip width apart, you hold a light weight in each hand, and then you can do circles that require you to go backwards and then moving your circles forward. You can do one arm at a time if you like, forward and backward. I'm sorry, I'm not demonstrating this correctly because I think my arm's going to hit the chair and the table as a circle. But you get the idea that we want to be able to use the full range of your shoulder muscle or your shoulder joint in order to get that forward and backward rotation of the shoulder. Okay, and then the other things you can do is you can start off by doing small circles and then make them big circles, and then you can go backwards small circles and then make them big. So you kind of go from a smaller diameter to a very big, large diameter when you're moving your arms. So you can repeat this exercise 10 to 12 times on each side, and again do it forward and backwards. You could do about 3 sets per side, and that will give you a nice shoulder range of motion workout. There's also some stabilizer type work that you can do. So for example, the supraspinatus muscle, it's one of the most common muscles or tendons that are injured. And if you are able, I'm just going to move back, hopefully you can see me. If you hold your arm out at a 45-degree angle and your thumb is pointing down, and you lift your wrist so that it's just a little bit higher than your shoulder, and you hold that position, that is a great stabilizing activity for your shoulder. And you can improve your endurance with that, with the amount of time that you hold your arm out with, and you can also hold a weight if that is something that you want to challenge. Of course, if you hold it for about 30 to 60 seconds, and then you repeat it on the other side, giving your first side a little bit of a rest, and then as you get better, you can increase the amount of time that you're holding it up to 60 seconds, and you can also increase the weight if you think you can manage. Of course, this needs to be approved by your practitioner, and if you have a history of rotator cuff tears, I would hold off doing that unless you have specific instructions with your doctor on what is appropriate for you, because you don't want that tear, a partial tear, to become worse, and in worst cases be completely torn because you're putting stress on that shoulder joint that you're not able to withstand. Okay. All right. So avoiding on-the-job injuries is really important too. So if you work at a desk, make sure your workstation is comfortable with how you're using your computer. And this is a service that I can provide to you with telehealth. If you want to have me do a telehealth consultation for your home working environment, or your desk, even at work, if you are still going to work, I can arrange that. We can video conference in, and I can examine your workstation, have you sit at your workstation, and we can determine where you need to place or adjust your workstation to make it better for you. So you want to make sure that when you're working that you are very comfortable, that the monitor that you're using, the center of that monitor is not more than 15 degrees below eye level. And you want to make sure that your knees are at the same level as your hips, maybe even slightly lower if you like. You want to avoid sitting for long periods of time. So, every 15 minutes to a half hour, get up, go get a sip of water. One patient relayed to me that they had a little, a coaster on their desk, and that coaster was supposed to hold their water bottle. And so whenever they looked at the coaster, it was a reminder that if there wasn't any water in their water bottle, that they need to drink that water or get more. And that way they were always replenishing and staying hydrated, which is a really great idea, I thought. So when you have a glass or a water bottle, you put it on your coaster on your desk and make sure you always take a sip from it. Also, when you're sitting, make sure you keep your back straight and don't strain as you're trying to reach things. You know, if you wanted to reach something up high, there, you know, grab a stool and step on the stool, and then you'll be able to reach it better. So it's less strain on your shoulder as you're trying to reach up on very high surfaces. And also, if you use specific items very regularly, why not store them indoors that are in, you know, indoors or shelves that are lower and easily accessible? So that's another tip. Instead of reaching really high to get your favorite dish, like keep those all at the same reachable height, and that way you can avoid injuring yourself. So if you sleep on your side, sleeping positions are really important. If you sleep on your side, be careful not to put all of your weight in your shoulder. There are pillows that we have. I've only sold one type of pillow in my practice for the last 20 years, and it's called a Therapeutica pillow. And it's got a elevated portion, so when you sleep on your side, your head doesn't tilt down. And on the back, there's a reduced elevation so that your neck is not in flexion when you're sleeping. So having the right pillow is really important. And this is something that I can also help you with on telehealth. You know, we can get online together. I can take a look at what you are sleeping with and your sleeping positions, and then I can guide you on how to adjust your pillow in order to help evenly distribute your weight on your neck and on your shoulder. So also you may want to consider alternating your position when you're sleeping. Sometimes people can benefit from putting a pillow underneath their knees if they're sleeping on their back, and that takes a little stress off of their back. And even when you're sleeping on your side, you're not just looking after your neck and your shoulders, but you also can put a pillow between your knees so you help prevent that leg from rolling over and stretching out those pelvic muscles, especially the piriformis muscle in the back. Okay. So shoulder impingement usually takes about 3 to 6 months to heal completely, and more severe cases can take up to a year to heal. We have seen a lot less healing time in some of our clinic patients that we've been helping. And I've got 2 case studies that I'd like to go over with here just coming up to help guide you to understand, you know, what you can do, the power that made the body heals the body. So, you know, if we can accelerate how that healing is occurring, that's to everyone's benefit. And so, you know, while you can generally return to basic normal activities within 2 to 4 weeks after you've hurt your shoulder, there is a long period of time when shoulder injury does recuperate. If you do injure your shoulder, resting and icing are important every few hours. I wouldn't put ice on any tissue for more than 10 or 15 minutes because the body can have a reflex reaction where it will shunt more blood to the area, thinking the area is getting frostbite. So, you know, 10 minutes of ice is plenty to try and calm that swelling down if needed. But remember, the swelling is there because our body is trying to send some resources to the area to try and fix the problem. So icing is good, but it's also good to have that inflammation a little bit there if you can manage the pain. And then, of course, persistent pain should be discussed with a doctor like myself. So when we talk about, you know, back pain, and your back pain and your shoulder is very much connected to your upper back, and a lot of people who have issues in their shoulder can also experience upper back or neck pain. Chiropractors are known for treating back pain, neck pain, and headaches. And chiropractic care can be extremely beneficial with pain associated with shoulders and other extremity pain. So no matter what your specific shoulder issue is, the chiropractor will begin by first targeting a specific diagnosis to figure out where the source of your pain is coming from. Where is the irritation beginning from? And then once the diagnosis of the problem has been made, then we can be specific in applying your treatments, whether there are adjustments or other treatments that might help your shoulder pain resolve. And chiropractors also can use a lot of modalities for pain. I'm going to discuss 2 modalities here today, the frequency-specific microcurrent therapy and our ARP Wave Therapy, so that you can understand a little bit about what makes our office unique. So again, chiropractic treatments help reduce stress on the spine and all the structures that house the nervous system. And remember, it's about trying to improve the communication between your brain and your body. And this is very important. This communication helps your body function properly. And when you don't have proper communication, sometimes this can lead to symptoms of pain and dysfunction. So the World Health Organization has identified, has a definition for health, and this is when all of your body's cells, tissues, organs, and systems are functioning 100% all of the time. And so we need a healthy brain and nervous system in order to have that function. It's the power that made the body that heals the body, and we want to give our body the best communication strategies you have. And so if you have any stress on your spine due to postural stress or injuries, or you have stress on any of the nervous system, the peripheral nervous system too, that miscommunication or problems with how the brain is able to direct instructions for how different structures in your body are supposed to work, that can be a problem. So we want to try and help your communication systems in your body work better. And that's what chiropractic does. We also have something called frequency-specific microcurrent in our clinic. Now, microcurrent machines are clinically, they're defined as TENS machines, but they're not TENS machines. TENS machines are currents that you can feel, like the little Dr. Ho that you hear on commercials. You can feel the pulsing of a TENS machine, versus a microcurrent machine is firing frequencies that are very, very low. A TENS machine might fire 1,000 milliamps or higher. Microcurrents are less than 1,000 milliamps, and most of the microcurrent frequencies we run in our office, most of the intensities are about 100 to 200 milliamps. So people don't even feel them. But what they do is they work on the resonance effect. So you may have heard of the story of the opera singer who holds their note, holds their voice at a specific frequency, and just is able to maintain that resonance, and it interacts with lead crystal glass, and it matches. The human voice has the ability to match the resonance holding lead crystal glass molecules together with what we can resonate in our own voice. Maybe not myself, but an opera singer. And that can interact. And when those two vibrations interact, you cause disharmony, and then the glass shatters. Well, in the same way, we can use microcurrent and program frequencies that cause molecules to resonate together. And when they resonate together and they have that vibrational interaction, sometimes, well, a lot of the time, we see things like myofascial pain from trigger points improve, tendinitis pain improving, nerve pain improving, peripheral neuropathy pain improving, fibromyalgia, anything that has to do with inflammation. Frequency-specific microcurrent is known to help reduce inflammation in the body. And we know when we have inflammation, we have pain. You cannot experience pain unless you have an underlying tone of inflammation. And so our microcurrent technology can help people reduce their inflammation. And then the last therapy that I wanted to talk about very briefly here is our ARP Wave technology. It's called Accelerated Recovery Performance. So basically, when you are trying to signal tissues, if you're going to go to a gym and you try and exercise by doing a biceps curl, you can do one curl every second, perhaps. Right? Well, this technology allows us to stimulate muscles up to 500 times a second. So it is very useful in trying to restore your normal range of motion. It helps to reduce pain. And in fact, we were one of the first clinics in Canada to adopt the ARP Wave technology. Many of the sports professionals, NHL and NFL players, they have this technology in their locker rooms because they need to be able to treat these injured athletes and be able to get them back on the field right away. So this is a very special, unique service that we have. And we do screen who we use this for because there's a lot of dietary and hydration components that are required for being a patient for using this technology. But it is phenomenal. And I hope that if you do have a persistent problem that has not been solved with other therapies, perhaps you want to come in and consult with me and I can help you with this. So remember, there's no one-size-fits-all approach when it comes to treating any type of condition, and especially with the shoulder. There's so many different structures, there's so many different things that can be happening simultaneously. So whether you're interested in prevention or working on rehab, we got to remember that we have to be customized. So each person has unique anatomy, has unique medical history, different symptoms, different diagnoses. Their goals might be different. A professional athlete might have different goals than someone who wants, like a mother who wants to lift their 20-pound child up off the ground. There's so many different things that need to be considered when trying to choose treatments for exercise and rehab. So it's important to speak to your health professional about this and make sure that you gain rapport. It's really important to make sure that the person you're working with has the same goals as you do, because otherwise you're going to be working in different directions, and we want to make sure that you are both working together with a common goal. So I'd like to share a case study about a patient of mine, Jenny. She's actually on this webinar today. So thanks, Jenny, for allowing me to share your story. She had a rotator cuff injury, and it was through playing competitive volleyball. Maybe it's not really competitive, but she is very competitive. So she was playing volleyball and hurt her shoulder, and she was hardly able to lift her arm at all when she came in. Maybe 20 degrees at the most, but that might be generous. And what we decided to do is to ultrasound her shoulder before we did any type of therapy, because the examination led me to believe that there might be some instability in her shoulder. And you never want to go in blind. You always want to make sure that you're doing the best for your patients. So I went in and I said that we should do an ultrasound. And there was a partial thickness tear of the supraspinatus tendon, which is one of the rotator cuff tendons in her shoulder. And it was measured. The dimensions of the tear was actually measured in the ultrasound. So our treatment trial was, let's do some chiropractic care and let's add some frequency-specific microcurrent. And we would do both of those simultaneously for 12 sessions within a 4 to 6 week period. And so Jenny's range of motion, this is Jenny, isn't she lovely? Jenny allowed me to take this picture. I think we were maybe the second or third week, or second week into care. It was probably the second or third treatment that she had. And so her range of motion had quite improved from being only 20 degrees, where now she's able to hold her arms out to her side, which is really great. She was very happy. Her pain had reduced some, but she didn't quite have the full range of motion. So I thought, wouldn't it be a great idea? Let's take a picture before your therapy, and then let's take a picture right afterwards and see if there's a difference in her range of motion. And so right after her therapy, that was her range of motion. And you can see how happy she is. She has no pain as she's lifting her shoulder up. And it was so amazing to work with Jenny because she was really consistent with what I recommended. And she started to see results very quickly, which is what we want for every one of our patients that comes in to see us. And the good news is that the treatment trial that we had initially started for 12 sessions actually got shortened because she had achieved full range of motion and was pain-free far sooner than we expected. And so what we did as soon as her treatments were done, we immediately ordered a second ultrasound. And there was a 30% improvement in her tear, which meant within less than a month, she was able to heal her tear a lot faster than if it was just watching and waiting and resting. So we were very excited to see the pre and post ultrasound results, that there was a 30% improvement. I mean, it would have been nice if we saw more improvement, but you know, she decided that she had a pain-free range of motion, and she had promised that she wasn't going to play volleyball as aggressively, which will hopefully keep her tear manageable and it won't get worse. So that's a really, really great story. And here's Jenny. She was happy to leave us a 5-star review on Google. For any of you who are interested in learning about what we're doing in the clinic, go on to our website or go onto Google and click Chiropractic Wellness Clinic and read our reviews. We've got some really great patients who are so kind to share their stories with other people who might help them improve their health. So it was hard for her to raise her arm and get dressed. And you saw at the end there, or even just at that second picture that we had right here, how she went from horizontal, and then within one session, how everything, oops. I think I'm clicking too many here, sorry. How she went from horizontal, full range of motion. And yeah, you know, there was a need to repeat the treatments because it didn't last, so we had to repeat them. And then at the end, of course, when we had seen that she had improved a significant amount, we could stop therapy. That's when we did that second ultrasound and saw that improvement. So it's really great to be working with people who would like to collaborate with their medical doctors, because I would love to be able to work with your medical doctor in trying to get pre and post imaging done in order to see how things have changed with how well you improve with your shoulder pain or whatever your concerns are. So I also wanted to talk about this other gentleman. His name is Eric, and again, like, there's no cookie cutter approaches in managing shoulder pain symptoms, and I'd like to share a little video that he put online for us. He had shoulder pain for about 7 years and couldn't find any lasting relief. So let's listen to his story here. Oh my goodness, I'm getting all this stuff about volume not working. I am so sorry. Okay, well, what I'm going to do is I will send you a link, and I'll also post the link on the comments on the YouTube video so that you can click on it and hear his story. Basically, he had been to many athletic therapists and physiotherapists and chiropractors, even did acupuncture. He had 7 years of shoulder pain and couldn't find any lasting relief. And so we actually went in and started working on ARP Wave with him. So that was that therapy that I said can fire 500 signals a second. Well, I mean, he's really athletic and he liked to work out, but every time he would do anything, he would be in a lot of pain for a few days afterwards. And there was only one position that would relieve his pain. And so with the ARP Wave Therapy that we did for him, he had full range of motion, pain-free. He's back to his regular lifestyle and very happy. So I will forward that to you. My apologies. I didn't realize that this video wouldn't, the audio wouldn't go through on that. So I'll definitely send that to you. So many of you may have challenges, whether it's shoulder pain, neck pain, back pain, problems with a whole bunch of different challenges that could be happening in this time of physical distancing. I know a lot of people are very sedentary because we've been told to stay indoors. We can't play our sports with our friends. We have basically restricted a lot of interaction between people. So there are insurance companies that will reimburse you for chiropractic telehealth services. And I've listed these up here: Alberta Blue Cross and Canada Life, Sun Life, Manulife. And, you know, while we are physically distancing, maybe it's a good idea for us to use this time to try and heal some of the challenges that you might be having with your shoulder, with your back, and so on and so forth. So maybe we can get together on a video conference call and I can guide you through a proper history and examination to properly diagnose what the problem is that you're experiencing. Is it a tendinitis? Is it a bursitis? Is it impingement? It all looks the same to most people, but there are certain things that we can do to understand what your problem is, and we can do this virtually. And then if you have some imaging or other data, we can certainly add that to the information. And then once we've been able to diagnose and figure out what the problem is, we can identify specific strategies to help you so that you can begin working on fixing this. And again, the best time to do this is right now when you're not engaged in all these physical sports and you know, really working your body out. It's a time of resting, reflecting, healing. And so maybe we can try and extend that to some of the issues that you have and work on things from an exercise rehab perspective so that you are healthier. And when this physical distancing bans are lifted, then when you go back to your sport or you go back to your regular lifestyle, you go back with less pain, more range of motion, more flexibility, just better ability to do what you want to do. And that is my hope for you. So please don't hesitate to contact me so that we can help you do this. There's no better time to look after your symptoms, and I'm here for you if you want to go ahead and do that. So we do have a number of resources that went into putting the presentation together, so I'll be happy to post these on the YouTube page as well as on the follow-up email you'll get after this webinar. And so we did it. Congratulations. We are, we talked about all the different conditions that can cause shoulder pain. We talked about various therapies that can help you with shoulder pain. Talked about a couple of patients that had shoulder pain that recovered well from that. So I hope that you really enjoyed this webinar. I know we covered a lot of information, but know that I'm here to help you. You know, if you would like to come in for a consultation whenever you think that's appropriate, once the physical distancing is lifted, we can help you with that. If you want to get involved and start now, we can manage that with telehealth. And again, insurance companies will cover the cost of those services. So I want to thank you very much for taking the time out today. I know you could have chosen to do anything this afternoon, and you chose to be here with me. And I do value that. I really appreciate that. I hope that the information we're sharing on these webinars has been valuable, and that you really enjoyed this seminar. So thank you so much, and I'll see you at next week's webinar.